Hi, my name is Sierra. I am the Clinical Application Analyst Trainer. Today we are going to talk about care alerts. Care alerts are utilized to alert staff of plan of care guidelines for patients with additional considerations or needs. We are transitioning to storage of care alerts in the electronic health record. This will ensure that the care alerts are accessible for updates and follow-up. It is important to note that checking for care alerts must be incorporated into your standard work process during admission, transfer, and discharge. As you get familiar with this process, I recommend using the Care Alert tip sheet, which provides a workflow with step-by-step instructions on how to facilitate a care alert. The Care Alert question will exist in the assessment, which are different for each department. For this example, we will look at the ED past medical surgical history. Here is the Care Alert question, which asks, is a care alert on file or is one needed? Yes or no? And there are some instructions to prompt you to check the summary and legal indicators, and to also check the blue eye in the header for care alerts. To check for a care alert, first you'll go to Summary, and then you'll go to Legal Indicators. If you see a continuity of care in the list of documents, that means that the patient has one on file. If you see continuity of care, select Yes. If you don't see one here, go to the blue eye in the patient header to check if one has been documented. If you see a care alert row, select Yes. If you don't see a care alert here and the patient doesn't need a new care alert, then you can select No to that question. If you answer the yes to this question, when you save the assessment, a prompt will display. By clicking OK to the prompt, the care alert assessment will automatically be pulled to the work list. If you find that you need a new care alert for this patient later, you can manually add the care alert assessment by going to the work list, clicking Add, then search the care alert assessment. If a care alert has been previously charted, even if it was in a previous visit, the care alert assessment will recall all the data for the last time it was documented. Some of the queries in the care alert assessment are required. If a care alert exists for this patient, it should be updated every time that the patient visits the hospital. So as you can see here, this has auto-populated the information from the previous care alert assessment. If a behavioral contract is on file, select Yes. Upon selecting Yes, a pop-up will appear to remind you to review the scanned behavioral contract in the electronic medical record, which should be in Summary under Legal Indicators. The care alert elements are some of the special considerations for the patient. The caregiver recommendation is not the patient's preference. Instead, it is the staff recommendation for gender of the people working with that patient. The therapeutic milieu are recommended items that promote the healing journey for the patient. Lastly, a free text box is available to elaborate on care needs for the patient. When you are done updating the care alert, click Save and Exit. If you have any questions or concerns about care alerts, please feel free to contact me. Thank you and have a wonderful day.